What to do if you have had close contact with a person with COVID-19. You can spread COVID-19 to others starting a few days before you have any symptoms, and even if you have never had any symptoms. It is important to separate yourself from others after an exposure so that you do not spread the virus even without knowing it. Exposure or a close contact. If a person has spent a total of 15 minutes or more within a 24-hour period within 6 feet or less of another person with COVID-19, that is considered an exposure or a close contact. Identifying the term quarantine. Staying home and staying away from others when you may have been exposed to the virus. Identifying isolation. Staying home and staying away from others when you test positive, feel ill, or have symptoms of the virus. What constitutes a well-fitting mask? A well-fitting mask is a mask that fits snugly over your nose, mouth, and chin without any gaps at the edges. What does it mean to be immunocompromised? That is, an individual with a weakened immune system. The immune system is how the body fights against disease. Who does not need to quarantine? If you have had a close contact with someone with COVID-19, you do not have to quarantine if you are already 5 years old or older and have completed all recommended vaccine doses, including a booster, or if you have already had COVID-19 within the previous 3 months to exposure. After exposure to the virus, you should still do the following. You should still wear a well-fitted mask around others for 10 days from the date of your last close contact with someone with COVID-19. You should monitor your symptoms for 10 days. If you start to feel sick, you should stay home and stay away from others, isolating, and test immediately for COVID-19. If you are already up to date on all recommended vaccinations regarding COVID-19, you should get tested at least 5 days after your close contact. If you have already had COVID-19 within the previous 3 months to the close contact, you do not need to get tested at 5 days after the close contact if no symptoms arise. You should quarantine if you have had close contact with somebody with COVID-19. You would need to quarantine if you are not vaccinated, or if you are not up to date on all vaccinations, including the booster. How should you quarantine? To quarantine, you should stay at home for at least 5 full days after your last close contact with somebody who has COVID-19. You should monitor your body for symptoms for up to 10 days. If any symptoms develop, test immediately for COVID-19 and follow all isolation recommendations. If it's possible, it's recommended to stay in a separate room and away from other people in your household. This includes using a separate bathroom if possible. Avoid sharing personal household items, which include things like food, dishes, towels, or bedding. Also, avoid the use of public transportation, airplanes, buses, trains, as well as ride-sharing apps like Uber or Lyft and taxis. If you are able to wear a well-fitting mask and you do not develop any symptoms, continue to wear the well-fitting mask for 10 days when you are around others. This includes people in your home. Staying home and staying away from others for 5 days, and if you can, test on day 5. If your test is positive, start counting again from day 0 and follow all isolation recommendations. If your test is negative, finish your full 5 days in quarantine. Then, during days 6 through day 10, do the following. Avoid places and settings with people who are immunocompromised or are considered at a high risk of severe disease if contracting COVID-19. Avoid travel. If travel is a must, wear a well-fitting mask. Avoid places where you cannot mask. This includes gyms or restaurants. Continue to wear a well-fitting mask around others when socializing. If you do start to feel ill, stay home and away from others and test immediately for COVID-19. If you are unable to wear a well-fitting mask, do the following. People who are unable to wear a well-fitting mask includes individuals under the age of 2, people with certain disabilities, and others who cannot consistently wear a mask. These individuals should stay home and stay away from others for 10 days. They should test on day 5. If their test is positive for COVID-19, start counting again from day 0 and follow all isolation recommendations. If the test is negative, continue to quarantine for the full 10 days. If you start to feel ill, stay home and stay away from others, isolating within the home, and test immediately for COVID-19. If someone in your home has COVID-19, what should you do? If you live with someone who has COVID-19, stay home while they are in their isolation period, and then begin your quarantine period on the day their isolation ends. This may mean that you have to quarantine for 10 days or greater. If multiple individuals in your home have COVID-19, your quarantine period will start after the last person has completed their isolation.